I'm Dr. Linda Shell, and this is Overview of Healthcare and Medical Needs for Seniors. This presentation will be an overview of the aging process, health issues of elders, medical terminology, medical management, preventative care, emerging healthcare trends, and then aging in the context of a Christian worldview. When we start talking about the aging process, aging is really associated with those changes that occur in the body, whether they're biological, physiological, environmental, psychological, behavioral, or those social processes. Some age-related changes, such as graying of hair or maybe even loss of hair, are benign, but others can be significant. For example, declines in the function of the senses, our ability to see, our ability to hear, activities of daily life, or increased susceptibility to or frequency of disease, frailty, or disability. All of those can be things that can significantly impact an older adult's ability to function. And many times we find that those are the things that tend to bring people into a senior care setting. In fact, advancing age is the major risk factor for a number of chronic diseases in human beings. But I always like to remind people that when you've seen one elder, you have seen one elder. For example, a few years ago, I ran in a 5K, and in that 5K, I actually got beat by a 74-year-old man. So when I think about people who are living in the nursing home, many of them may be in their 70s or 80s. But this gentleman was out there running a 5K. Or another example might be my mom, who lives in an assisted living. She's 98 years old, and she actually leads 3 activities a week in the assisted living. She's alert, she's oriented, she's very in tune to what's going on around her. She's very social. Her health has been quite good. She takes very few medications, has very few diagnoses. So just a reminder that as people start to age, we start to see a variety of differences in how they're able to respond to the environment around them. Here's some common issues that we see in elders as they age, and here's the top 10. The first one is hypertension. As people start to age, we know that they tend to be more at risk for developing hypertension. High cholesterol tends to occur as well. Arthritis, which is just the breakdown of the joints. Several years ago, I worked in a falls program, and one of the things that I learned from a physician that I worked with is that there tends to be a correlation in the amount of arthritis that someone has in the body and their age. So, for example, when we think of somebody who's 75, maybe 75% of their joints are starting to experience that deterioration that results in arthritis. But then if we look at a 90-year-old or even 95-year-olds, thinking about how much arthritis they could potentially have, which what that means is that they may be slower at getting up, they may be slower at walking. In the morning, they may tend to be a little stiffer. And so movement is really important for those people. And then ischemic heart disease, which is quite common in older adults, diabetes, adult onset diabetes, and chronic kidney disease, which can be correlated to diabetes. And then heart failure, depression, Alzheimer's disease, and chronic obstructive pulmonary disease, COPD, most often the result of long-term smoking. We're also going to be looking at the variety of medical terminology that you hear in the field of senior care. There are numerous terms that are often used just in long-term care. For example, you might hear it referred to as senior care, skilled nursing facility, a nursing home, a rest home, a home for the aged, or now even a rehab center. So there's a lot of terminology, but generally when somebody is referencing what's known as a skilled nursing facility or a SNF, it means that they are living in a place where there is 24-hour nursing care required for that person. When we get into assisted living, that's not the case. Generally, in assisted living, you'll just have a nurse maybe 8 hours a day. In some assisted livings, you may have a nurse on 2 shifts, but generally not 24 hours a day. Although, as we're seeing increasing acuity in assisted living, we certainly know that we're seeing more and more need for nursing in those settings. And then post-acute care, which is very common in the long-term care or the SNF setting. And post-acute care generally occurs after a person has had an acute admission to the hospital, maybe for surgery, maybe they fell and broke their hip, maybe they had a stroke or some type of cardiac event. Generally, it requires a 3-day stay in the hospital, and actually that's a 3-night stay in the hospital, which will qualify them for their Medicare A benefits. And then they come into the skilled nursing setting for some type of rehab care. Most of these people will be discharging. The average length of stay in a rehab care environment is generally somewhere between about 14 and 18 days. That certainly can vary based on the diagnosis, but that's pretty common in the long-term care setting or in the post-acute setting. And then long-term care is often used to refer to assisted living, independent senior housing, housing with services, home health, adult day programs, and memory care, because it can actually be an umbrella term that refers to all of those. And then another term that I already used once is that Medicare A. When seniors turn 65, they qualify for Medicare. And under Medicare, there's Medicare A, which pays for acute care services. It covers post-operative care associated with a hospitalization, but generally for people to continue to qualify for Medicare A, even when they go into a rehab unit, they have to be able to make progress and participate in therapy. And many times they have to be able to participate in therapy at least twice a day for them to maintain their ability to qualify for Medicare A. And then there's also Medicare B, which can cover vaccinations. It's often will cover wound supplies, specialty beds, diabetic supplies can be covered under that. So some nursing home patients will have some Medicare B coverage that pays for some of those ancillary services. It can also pay for therapy that is outside of a Medicare A stay. So as we think about aging adults and preventative care, there are some important things to consider, especially for older adults, as we look at what do they need for preventative care. So number one is to just ask what benefit will be at this age. So if a person is 85, is it going to benefit them to get it? Flu vaccine would be an example. No matter what age a person is, a flu vaccine can be very beneficial. And in a skilled setting, we're required to offer all residents a flu vaccine. They can decline that, but we are required to encourage them to take that. And then when we start thinking about other types of screenings, for example, cancer screening, if somebody has a life expectancy of 5 years or greater, then cancer screening might be appropriate. But certainly you also want to weigh the benefits, such as the preventive measure, something that can reduce disease or symptoms. For example, I've had the experience of having an older woman that was in her late 80s who was diagnosed with breast cancer, but the breast cancer was very slow growing, and so they decided that the chemo to treat that and the radiation would be much harder on her than if they just allowed her to continue the way she was. And she actually did quite well and lived another 5 years and did quite well with that. And then too, thinking about the likelihood of harm, that could be the case even with chemo and radiation. As we know that those can take a terrible toll on the physical being. And as we think about aging adults, and already they're starting to have breakdown in their muscles and in their organs and the systems of the body, adding chemo, radiation, or other type of things on top of that can certainly cause more harm than good. But the most important things that you can do really at any age, but even as we think about older adults, that we can do to prevent disease and be healthy are to continue to exercise, to continue to eat healthy, and don't smoke. So even when we're thinking about senior care and the people that we serve, things that we can do to still encourage them to exercise, to get up and to move those joints around, to make sure that they're eating healthy, and then if they're a smoker, to do things that we can to help them reduce their smoking. And then looking at some recommended preventative care for older adults, I talked about influenza. Pneumococcal to prevent pneumonia is an important vaccine for older adults. getting a tetanus shot. And then one of the newer vaccinations that's available now is for shingles. Shingles is a disease that can be very painful. It generally, for people who've had chickenpox as a child, chickenpox always lives in our neurological system, and as we get older and our immune system decreases, people can be at risk for breaking out with shingles. And shingles, it grows along those nerve lines, and it's incredibly painful. It's also can be highly contagious. So if you have staff that are pregnant or in the process of getting pregnant, it is not a good idea for them to care for those people, because it is like chickenpox and it can be very contagious. The good news is that there's a vaccine that older adults can now get to prevent them from getting shingles. And then just thinking about other screenings that might be appropriate in the senior care population, alcohol screening, and we're seeing an increased use of alcohol in senior adults. Breast cancer, thinking about blood pressure, colon cancer, depression, diabetes, lipid or cholesterol, obesity, osteoporosis, and then abdominal aortic aneurysms. All of those are screenings that would be appropriate in a senior care population. And then, once again, just some preventative actions that older adults can take to try to remain healthy for as long as possible. Taking an aspirin a day, once again, exercise, healthy diet, limiting alcohol, and then not smoking. So there are a variety of emerging healthcare trends that are important in senior care, and one of the ones that there's lots of discussion about, no matter what level of care that you're working in, and that is around health insurance coverage. Even on the national stage, there's lots of conversation about the Affordable Care Act, about Medicare and Medicaid. And as we have this increased demographic of older adults, and we start to see people who are poor and that are going into the Medicaid system, we know that it puts stress on the budgets at the state level as well as the national level. And so more and more conversations will be had about how we're going to continue to fund Medicare, Medicaid. And then in Minnesota, we have an elder waiver program that people can live in, people who would in the past maybe have ended up in a skilled nursing building, but now they can use elder waiver if they meet the criteria for staying in assisted living, and it can help pay for some of their care. And it's for people who are low income, but it's a wonderful program, but it is severely underfunded at this point in the state of Minnesota. And then another healthcare trend that we have to think about as we work in senior care, and that is the declining workforce, the pool of people that we have to attract and hire into positions, things like in culinary, in activities, in maintenance, in housekeeping, nursing assistants, home health aides, and even nurses. We're seeing shortages in all of those areas. And on the nursing side, there's a 22% growth in the demand for nurses. And as we have this aging population, as people think about providing different levels of care, and more programs are coming online that provide care for seniors and that really keep them from going into the nursing home, what we're seeing is that there's more opportunities for people to be employed in a variety of different areas of senior care outside of the nursing home and the assisted living. So that tends to pull people away from those settings. Nurses have very diverse opportunities these days, so it's becoming more and more challenged to attract nurses. And then what we're seeing is that many of those baby boomers that have worked in senior care settings for many years are now retiring, and we don't have as many new employees coming into our workplace to be hired. So we're having an increasing amount of employment challenges. Currently in the state of Minnesota, for every one position that's open, there are only about 1.5 applicants for that, which means that you may have an open position, and in the past when maybe we would have had 3, 4, 5 people to interview and to be able to pick from for our hiring, it's very possible that you may only have one or two people to pick for in that position, which also in turn means that for us as leaders in the field of senior care, we have to think about how can we grow and develop our employees, because we may be hiring people who don't have much experience and who are going to need a lot of coaching and development. And then another emerging healthcare trend, which I've talked a little bit about already, is the increasing demographics. In the state of Minnesota, 65,000 people are turning 65 each year. That's a significant amount of growth when it comes to people over the age of 65. In the state of Minnesota, there are more people over the age of 65 than there are in K through 12, but much of the state budget goes toward K through 12 versus people over the age of 65. So you can see that as we continue in this trend of aging boomers, that the state is going to have to take a closer look at how are we going to fund, how are we going to take care of these aging adults as they grow older. And then we're seeing increasing acuity in people. Now, I've worked in the field of long-term care for about 25 years. When I first started in long-term care in the nursing home, most of our residents were alert and oriented. They were up and walking around, and they were probably about 80 years old. Today, people that are living in the nursing home, the average person in Minnesota lives in a nursing home about 2.5 years from the time that they are admitted until generally that's where they'll pass away. And when they and as they move into the nursing home setting, many of them have many medications, they have many diagnoses, many comorbidities, and for many of them, they're still getting extensive treatment for many of the challenges that they have going on. So definitely increasing acuity, and certainly then in the post-acute side, which we also have in long-term care, we have very high acute patients that need extensive nursing time. And then we also have the well-informed consumer. Just like all of us, whenever we want to know something about our health or something that's going on in our life, we can just go on our computer or phone and we can Google that and we can find out about that. That is the same case now in that we have consumers who are very well informed about their diagnosis. They're very well informed about long-term care. They're very well informed about what they should expect. And it also plays into that they are very well informed about your organization, about your facility through social media. They can find out through the 5-star report about how well your facility does with staffing and with their survey. They can find out on social media what other people are saying about your facility, maybe what some of your employees are saying about your facility. So the world has changed very much in how people think about long-term care, and it's very important for us to be aware of this knowledge that people have about their health and about our organizations. And then changing psychographics, and that is that the expectations of the boomer population that are moving into senior care are very different than that older generation, the greatest generation that they were known as. What they would have had. What we see from baby boomers is that they are interested in having a coffee shop and having a gift shop. They're interested in a private room. They're interested in lots of space, being able to bring in their own furniture. They're interested in having as much control as possible and maintaining the same lifestyle that they have had in their home as when they come into our settings, which can be a challenge for us on many fronts. And then thinking about technology and how that's changing the world of senior care, one of the biggest areas that I can think of over the last 5 years is probably just electronic medical record. The ability to be able to have everything on the computer so that it can be accessed at any point in time by any different staff member that needs to have access to that information. And so electronic medical record has definitely been helpful. We can do analysis, you can run reports, you can, as an administrator or as a director of nursing and senior care, at your fingertips, you can pull up the number of falls that have occurred. You can look at the number of incidents that may have occurred. You can look at vulnerable adult reports, or you can look at medication trends. There's just a variety of things that a manager in a senior care setting could easily have access to. And skilled nursing buildings, post-acute, have electronic medical record, but now we're seeing electronic medical record in adult day, home health, assisted living. So it is definitely having an impact on the way that we're able to deliver care. And then just one example of technology is pharmacogenetics. And pharmacogenetics is the testing of the DNA to make sure that people are taking the right medications that's a match for their DNA. So in every class of drug, there are about 30% of the population that are resistant to certain drugs. So, for example, in the, I call them the anti category, anti-anxieties, antipsychotics, antidepressant, there are going to be about 30% of the population that are going to be resistant to different drugs. You can actually test a person's DNA and then look at the medications that they are on, and you can find out through DNA testing if the person is on a medication that's right for them. And what I think is so powerful about that is that one of the challenges that we have is that the average person in a nursing home is on somewhere between 13 and 17 medications a day. That takes an enormous amount of time, not to mention the quality of life. Just imagine what it would be like to swallow 13 different pills during the course of the day. How would your stomach feel? How would you feel about having to take that many drugs? And the research from CMS is very clear that 9 or more medications puts the person at a tremendous risk of some type of a drug interaction. So finding ways that we can make sure that people are taking the right drugs and the right timing for them, and that we were reducing their chance of interaction, is one of the things that pharmacogenetics can offer. And then just a variety of health monitoring. For example, the geofencing is now available. So let's say that we have a person who has dementia, some level of memory loss. Maybe they're still living at home, or maybe they're living in assisted living. You can actually monitor them through a GPS device, and you can set up fencing. For some of you that are familiar with the fencing that you do to keep your pets from running out of the yard, it's really the same concept. So you could set up geofencing within the parameters of your facility, and if the person goes outside of that, it would actually send an alarm to a staff member to let them know that this person has exceeded the geofencing, and they would tell you where that person is at, that you could go and find them. So that's just one example of some of the exciting things that are happening around technology, and there are numerous ones that we'll be looking at during the course of this class. So when we start thinking about senior care, one of the things that I think is really important for us who provide care for seniors, who really have a passion for taking care of elders, is to understand about ageism. Ageism is the stereotyping, the prejudice, or the discrimination against people on the basis of their age. And even those of us who are passionate about elder care can sometimes fall victim to being guilty of ageism as well. And sometimes these attitudes can actually lead to the marginalization of older people within our communities and have negative impacts on their health and well-being. I'll just give you a really simple example that I've experienced in my career. And I will say that when I was a new nurse working in long-term care, I probably had some level of ageism because I had a real lack of knowledge. But here's an example, is that so we have a person who lives in long-term care, and maybe they have difficulty getting up out of the chair. And so what happens is that the staff, instead of encouraging them to do as much as they can to get themselves up, the staff actually goes and starts to lift them up out of the chair. Or another example is that we have a person who has dementia, and they've forgotten how to feed themselves, meaning that whenever we go to feed ourselves, it involves what's known as sequencing, meaning a lot of different steps to do things. So just think about it. When you're feeding yourself, what do you have to do? You have to be able to select the fork, the spoon, the knife. You have to be able to pick it up. You have to be able to scoop that food. There are a lot of different steps in being able to feed yourself. So as people progress in dementia, they start to lose the ability to sequence, so that instead of being able to do the 15 steps it takes to feed yourself, they can only do 5. So our traditional approach to solving that problem would be for us to start to feed the person. But if we want to maximize that person's independence and not to see them as a person with dementia, but see them as a person that we want to help be as independent as possible and to help them keep as much control in their life in a time when there's a disease that's taking away a lot of their control, one of the things that we can actually do is to give them finger foods. And there are huge menus of finger foods. In fact, the example that I often share is McDonald's. When was the last time, outside of a salad, when was the last time that you went to McDonald's and you really had to have a knife or a fork or a spoon? Probably not, right? You could eat pretty much anything at McDonald's. So just thinking about when we look at people that are older, sometimes we feel like they need a lot of assistance, and instead of encouraging them to do as much as possible, we tend to help them too much, which causes their decline. So, for example, if we have a person that's having trouble getting out of the chair and we don't encourage them to continue to lift themselves, what happens is they lose their upper body strength. Pretty soon they can't get themselves out of the chair, which means that their legs will start to decline in their muscle strength and they may be at risk for falls. So that's just an example of how we can, as people who are passionate about elder care, how can we be on the alert and start to pay attention to these examples of ageism that we have observed in our personal or professional life. So just think about examples that maybe you have seen of ageism, or be on the alert of examples of ageism that you've observed in your personal or professional life. And then what can you do about it? How can we educate our staff to help them understand that we can't just look at a person and think, oh, they're really old, they need help, or they're really old, maybe they're confused, or maybe they forget things. I have had the privilege of caring for 95-year-olds that were incredibly bright and articulate, and so definitely did not meet that stereotype that we often have as for people that are aging. So trying to see people and get to know them as a person and find out what are the things that we have in common with people that we care for versus looking at how we may be different maybe in our age. And then I always think it's important for us to take a look from a biblical perspective on aging and ageism. And in Mark 12:30 and 31, it talks about the importance of loving your neighbor as yourselves. So many times whenever I think about caring for an elder adult, and in my personal experience, I think about how would I want someone to treat me if I were living in a nursing home, if I were older, if I were living in assisted living, or if I were in home health. How would I want someone to treat me? With respect and with dignity. I'd want them to get to know my personal story and find out the things that are really important to me. So as I think about loving my neighbor as myself, how can I love an elder just the way that I would want to be loved if I were older? And then in Titus 2:3 and 4, it says, hold in high esteem and value wisdom. You know, I often get comments from staff that are working in long-term care that come from various cultures across the world about their surprise that in the U.S. we put our people in the nursing homes, whereas in their country, an older adult, a grandfather or a grandmother, the family would fight over who they were going to live with because they hold such an enormous amount of wisdom. And that's not always the case for us here in the United States. But thinking about how can we hold in high esteem and value the wisdom of the elders that we interact, maybe just by asking them their advice about different questions. I certainly have gotten some great advice over the years from various residents that I've had the privilege of caring for. And then Leviticus 19:32, when we just think about this idea of respect and dignity, stand up in the presence of the aged and treating them with respect. One of the things that I learned a long time ago from a friend of mine who is an expert when it comes to dementia, is particularly in the older generation, is anytime you want to greet a man, hold your hand out and shake their hand. That's very traditional for gentlemen that are older, and it says to them that you have a level of respect and dignity for them just by putting your hand out. And some of the other things that we can do I think, to just show dignity and respect is when we're talking to somebody that's older, rather than standing above them, sitting down next to them, and if it's appropriate to even, touch them or hold their hand, but getting down on their level, even if possible, be lower than them, so that you can just demonstrate, just in the body positioning, that you have respect for this person and for the wisdom and for all that amazing years of experience that they have. And then Proverbs 23:22 says, "Listen to your father and respect your mother when they are old." And once again, I think this is just a great admonition for us to think about the importance of treating elders with respect. And I'll be real honest with you that you're going to come in contact with elders who are not always that easy to respect. Sometimes they're at very difficult places in their lives. I've also learned that many people that we care for have had very challenging lives, and those lives have left deep scars on them. And many times it's our opportunity when we interact with these folks in our care settings and in senior care, it's our opportunity to love on them and to show them the love of Jesus Christ, because maybe they have never experienced that in their entire life. So I just encourage you to think about that as you work in senior care. Some of the upcoming assignments that you will be looking at through the course of this, the next few weeks, you'll be doing discussion forums where you'll be talking about different issues of aging. There will be a terminology quiz. As I mentioned, there's a lot of terminology in this field, so there'll be a quiz to just help you learn more about that. We'll be asking you to interview an elder. And so you're going to be able to choose an elder that you're going to be able to do an interview and then write a paper about. And then there will be some reflection papers on some different topics. And then there's a couple of major papers that you'll be writing as well. But I think that you're going to enjoy this class. Thank you so much for being part of this class and sharing your passion for elder care.